Hello guys, so today I want to make a video about Efexor, and that is antidepressant medication, and I want to tell you about the side effects there is of this medication. So you need to listen here if you are taking Efexor. Very common, more than 10 out of 100 person get side effect: constipation, nausea, dry mouth, dizziness, headache, drowsiness, insomnia, increased sweating, including night sweats. Ordinary, a maximum of 10 out of 100 person get the side effect: fast pulse, ringing in the ears, enlarged pupils, visual disturbance, blurred vision, diarrhea, vomiting, taste disorders, weakness, chills, fatigue, weight loss, weight gain, too much cholesterol in the blood, decreased appetite, increased muscle tension, motor agitation, shaking, change in the skin sensation, confusion, nervousness, abnormal dreams, unrest and restlessness, unreality or alienation towards one's own person, own appearance, or part of one's body. Frequent urination, lack of urination, bleeding from the uterus, heavy menstruation, lack of or delayed ejaculation, lack of orgasm, decreased sex drive, erections problems, difficulty urinating, yawn, shortness of breath, itchy skin, skin rash, high blood pressure, hot flashes. Not common, no more than 1 in 100 person get the side effect: bleeding in the gastrointestinal tract, balance disorders, liver effects, allergy, swelling of the face as well as the oral cavity and larynx, difficulty coordination, muscle cramps, involuntary jerking movements, hallucinations, slightly increased mood, mania, feelings of unreality about surroundings and events around one, involuntary urination, hair loss, sensitivity to sunlight, minor bleeding in the skin and mucous membranes, fainting attacks, drops in blood pressure when getting up, low blood pressure, and the rare side effects, a maximum of 1 in 1,000 persons get the side effect: anemia, and increased risk of infections due to lack of white blood cells, increased risk of infections due to lack of white blood cells. Yeah, that was standing twice. Heartbeat, cardiac arrhythmias, glaucoma, inflammation of the pancreas, malignant neuroleptic syndrome, severe condition with IA fever and blurring of consciousness, hepatitis, severe skin rash, anaphylactic shock, an acute severe allergic condition, severe skin reaction where the skin perishes, serotonin syndrome, effect of ECG, too little sodium in the blood, degradation of muscle tissue, involuntarily slow movement, delirium, a condition with confusion and affecting visual and auditory impressions. Allergic phenomena. Very rare. A maximum of 1 in 10,000 persons get the side effect. Bleeding from the mucous membranes. Tendency to bleed. Increased tendency to bleed due to decrease in the number of platelets. Increased amount of the hormone prolactin in the blood. Involuntary movements. And the unknown side effects is stress-triggered heart failure, bleeding after birth, aggression, suicidal thoughts and behaviors. Suicidal behavior. Prolonged QT interval is a special type of disturbance of the heart rhythm, which is in some cases can lead to sudden death. Increased risk of increased risk of is about this bleeding after birth. Increased risk of postpartum hemorrhage has been seen with treatment within 1 month before birth with SSRIs or SNRIs. Serotonin syndrome, including fever, stiffness, tremor, muscle cramps, and altered mental state, and malignant neuroleptic syndrome, including muscle stiffness, involuntary movements of arms and legs, tremors, confusion, speech, and swallowing difficulties. High fever, unstable blood pressure has occurred. Both conditions can be serious and require prompt medical attention. The risk is increased by concomitant use of the number of other drugs, including other drugs for depression, certain drugs for migraines, and drugs for psychosis. There have been some cases where side effects related to sexual disorders like impotence, decreased sex drive, have persisted after treatment with SSRIs or SNRIs has been stopped. Special warnings: possible increased risk of suicidal thoughts or suicidal behavior at the start of the treatment, especially in under 25 years of age. In the first weeks of treatment and in case of change in dose, you must be aware of signs of possible suicidal thoughts or suicidal behaviors in everyone, especially with symptoms of anxiety or if there have been cases of suicidal behavior in the past. In children and adolescents, under the age of 18, there is an increased risk of both suicidal behavior and aggression. Caution is advised by decreased seizure threshold, previous cases of mania, tendency to bleed, glaucoma, increased risk of decreased sodium content in the blood, and hypertension. The drug should be used with caution if there is an increased risk of developing prolonged QT interval, a special type of arrhythmia in the heart. This applies, for example, to little potassium in the blood, slow heartbeat, various heart disorders, concomitant use of diuretics, and if you are a woman or over 65 years of age. If you get symptoms of heart rhythm disturbance like palpitations, dizziness, fainting spells, contact your doctor. And there is a risk of affecting blood sugar if you're suffering from diabetes. Blood pressure should be measured before treatment, at the start of the treatment, and when increasing the dose. For long-term treatment, measuring the level of cholesterol in the blood may be considered, as the product can cause dry mouth and thus increase the risk of cavities in the teeth. One should go for regular dental checkups. At discontinuation of treatment, the dose should be reduced gradually, usually over at least 4 weeks. In the events of sudden cessation, there is a risk of cessation symptoms such as dizziness, tremors, nausea, insomnia, and fatigue, hepatic impairment. And if you're using other kinds of medication, you need to consult with your doctor and inform about it. So Efexor must not be taken if you are being treated with Marios, antidepressants, Parkinson's disease, or infections medication, or if you have been treated with isocarbazepine and Mayo within the last 14 days. Treatment with Marios should only be started 1 week after stopping treatment with Efexor. Certain agents may increase the effect of Efexor and increase the risk of side effects. This includes bupropion, anti-smoking agent, and terbinafine, antifungal. Concomitant use of certain other antidepressants, SNRIs, certain painkillers, buprenorphine, fentanyl, and tramadol, certain anti-ADHD, amphetamine, certain anti-migraine triptans, and herbal medication containing pericon gives us risk of serotonin syndrome. Caution with concomitant use of agents that may cause prolonged QT interval, a special form of arrhythmia in the heart. This includes certain remedies for heart rhythm disorders, certain remedies for psychosis, as well as several antibiotics and antidepressants. So that was the list from min.medicin.dk, the source in the Danish drug homepage in Denmark. Please share this video if you're taking Efexor. Do you have any side effects of these ones? Then just comment below. And if you like, you can just subscribe to my channel if you like. And you can get more updates on new videos I make every single day about many subjects. So take care, guys. See you. Bye bye.